It is no news to anyone out there. Michael Douglas just went through, just a tremendous battle with throat cancer, which turned out to be from a virus that could have been detected by a dentist. It's just amazing. I don't think any of us would have ever thought that, but we have brought Dr. Daniel Nickles in. Of course, you practice off of North Pleasantburg Drive.
That's right.
For those who are trying to place where you are. And let's stick with this story, and let me ask you this question first. Why are we associating dentistry with the throat cancer in Michael Douglas? Explain the story.
Well, what we have found out is there's over 120 viruses of the HPV virus, and 2 of those contribute to 99% of cervical cancer. And the epithelium in the mouth and the female parts are the same. Right. And we started looking at a lot of these things. Michael Douglas popped up with oral cancer, and he said, you know what, it's been from smoking and drinking. They actually tested the tumor and found out it was an HPV virus. And the sad thing is these viruses are very detectable now in special salivary gland tests that we can do for you, where you actually bring you into the office. We have you rinse and spit. It takes about 30 seconds, no pain.
So it can be part of a regular 6-month teeth cleaning.
If it's detected by you, do you know what the procedures are? I mean, I assume you would send them on to a...
According to, where they are in the procedure, what we want to do is actually find it before it shows up.
Right.
All dentists perform an oral cancer screening, and unfortunately, by the time it's visual in the mouth, those people have about a 40% chance of surviving over 5 years. So if you find it in the mouth, 60% of those are going to die within the 5 years. So we're trying to find it when the virus is detected. The virus that is actually causing the cancer is detectable, and treating it right then and there so we can rid it from the body.
Right.
When you do take x-rays for the teeth, does that ever show anything suspicious? I'm just curious.
Sure. The x-rays, sometimes, we're always seeing, bone levels. We're also seeing a decay in the teeth also.
Yeah.
And there have been, unfortunately, cancers have shown up in the jawbone.
Okay.
But, like I say, by the time these, do show up and they are visible, they're pretty deadly.
But this is something called salivary diagnosis.
Exactly.
So it's like your doctor drawing blood, I guess.
Right. If you go see your physician, he can draw your blood, and they can find out hundreds of things by that blood, and find diseases early and treat those. Well, for us, it's saliva, and we find the bacteria that puts you at risk. I mean, everybody's heard of there's the oral bacteria causes gum disease. There's also 4 bacteria that we can find in the mouth that contribute to cardiovascular disease.
Really?
So instead of, treating these things, we are enabled now to start curing these things.
So for the people out there who say, I don't have a cavity, I brush all the time, I don't need to go to a dentist, they need to rethink that.
You need to think it, because, people say, who's at risk? We're all at risk. I mean, and if you kiss somebody, you can pass it on to other people.
You can spread disease.
Absolutely.
What's the old mononucleosis joke?
The kissing sickness.
You spread that?
Yeah.
Absolutely.
Well, let's talk about people who are afraid to go to a dentist because of pain, right?
Well, I imagine a lot of people, things have advanced so much.
It has.
I mean, it's not the same.
It's not. Things years ago, it was tough. I mean, dentistry has come a long way. We're moving into the 21st century.
Right.
And, it's not the most comfortable thing in the world, but it doesn't have to hurt.
No.
And, so, don't be afraid. If you're, call us anybody, we'll sedate you. We can get you to make it very comfortable for you. And so that we can find these things. Because by the time it hurts, a lot of times it's too late.
Okay. So early detection.
Early detection is always the key.
Yeah, assessment. Well, and you're seeing kids. How many kids are coming in?
Kids, we see a lot of kids. It's the next generation. One of the things about the kids is, we're still trying to fight, a lot of the carbohydrates and the sugars and the drinks. Absolutely.
Still evil, huh?
They're still creating more cavities for us.
I don't think I told you this. My granddaddy was a dentist, and he wouldn't touch the grandchildren. My granddaddy never put me in a chair.
Right.
So, I mean, and we've come a long way from that drill he pumped with his foot.
With his foot, absolutely.
You don't even remember that.
I've seen him before.
You've seen him?
I've seen him before.
But we have come a long way. And this testing that you're talking about is not painful.
It is not painful.
It's a swab in the mouth, I think.
No, it actually it's a rinse and spit. We give you a little solution, like a little saline solution. You rinse and spit. It's 30 seconds. And you don't need a referral. If you have a dentist you're already happy with, that's great. You don't need a referral from them. We'll get you and we'll test you. We'll send the results to them. We get the test results back in about 4 or 5 days. And, like anything else, early detection, let's catch it before it becomes a problem.
Who's a good candidate for it?
Anybody. I mean, especially if you floss and you find a little bit of blood in your floss, that is inflammation. And inflammation is the root of all disease. I mean, heart or vascular disease, cancers. Everything starts with inflammation.
Boy, that's an eye. You've opened our eyes. I didn't know all
kidding.
this. I really didn't. And for regular checkups, I'm assuming you tell people when they're in the chair about it.
We educate everybody.
Okay,
Absolutely.
that's good. Well, thank you.
Let's remind people where you are once again, North Pleasantburg Drive. You can find Dr. Nickles, because I always get that question after you leave. Where do I find him? Thank you, Dr. Nickles.
Thank you.
Appreciate it. Coming up, hey, Lord of the Dance tickets. We have more of this to give away. You don't want to miss it.
Michael Flatley's
Thank you.
Lord of the Dance.